Hi everyone, I am a psychology student at master's level in psychotherapy, and today we'll be talking about sex addiction and what it means for a disorder to be included in the DSM or not. So let's get to it.
This is a very controversial thing. The best kind of definition that I can tell you is hypersexual disorder is a controversial diagnosis or proposed diagnosis, and it is not included in the latest version of the DSM.
So let's talk about this definition and what are the different components of it. We start by discussing whether sex addiction is a recognized disorder in the DSM. And it turns out that it's not in the DSM-5 because it's a controversy. So why would a disorder be a controversy and not be included in the DSM? Well, the first reason is that there is controversy between researchers. So you have researchers that are specialized on this topic that disagree. So some of them are going to think that the disorder should be recognized as a standalone disorder in the DSM, and some of them don't. And when they can't reach an agreement, it's possible that the disorder just doesn't make the cut for the DSM. Now, just because a disorder is not recognized within the latest version of the DSM doesn't mean that the disorder doesn't exist. So, for example, you might have the different components of the disorder, which in this case would be behavioral and cognitive. So we have, later in the definition, we have distress, which is an emotion, the way that the person feels about what is happening, and behavioral. So we have, and the behavior is the repeated pattern of repeated sexual relationships involving a succession of lovers. That's the behavior, that's what I do. And the distress is what I feel about what I do. On garde ça. Un, deux. So those are things that exist. There are people who feel like that, who have this behavior and have this feeling about themselves. Un, deux. So these are people that exist, that have such behavior and such cognition, such ways of feeling about their own behavior. And just because the researchers didn't reach an agreement on exactly how to include it in the DSM, whether it's for its naming or for its exact behavioral and cognitive components, doesn't mean that no one suffers from this. And for example, you might take another classification guide. So the DSM is one guide for classifying mental disorders, but there are many others, such as the one proposed by the World Health Organization. And there have been periods of times where disorders were recognized in one of those, but not the other one. And then later both guides recognized the same disorder, etc. So it's a process, it's an evolution that is reflective of the evolution of research within the community of researchers. Now let's talk about the actual sex addiction and what this definition tells us about sex addiction. So we see that it is defined as a situation in which a person experiences distress about a pattern of repeated sexual relationships involving a succession of lovers who are experienced by the individual only as things to be used. So what are the different components of this definition that we have to focus on? The first one is the first word of the definition, which is distress. Distress is the way that the person feels. So a person may not feel distress about this whatsoever, in which case they wouldn't fit in the definition of a sex addiction disorder. And the second component that we have is the behavioral component, which is a pattern of repeated sexual relationships. This means that the clinician has to be able to recognize a pattern. It's just not just one time, it's probably not just twice, it's a succession of events that lead to the pattern existing. The last component of the definition is the perception of others. So we see that the person suffering from sex addiction has to see their partners only as things to be used, which means that in their own mind, they don't see the other people as other human beings of the same value. They see them only as things to be used. And I think this is an important thing to understand, because it means that people who just have a lot of sexual relationships with other people whom they might like or whom they recognize as real human beings will not fit this definition of a disorder, because having a lot of sexual relationships is not a disorder in itself. And so it's very important to understand that when we have mental disorders, usually it's not just one component. It's not just one frequency or one intensity. It's a frequency, an intensity, a perception, a pattern, etc. It's a long list of items that have to be existing at the same time in order to qualify for the disorder. And that is one of the most important things that you can understand about the DSM.
He was only distressed when he was caught.
He had a problem being caught.
Right.
And whether you stay with him or whether you don't, he is the father of your children. And so it's worthy of attacking that and trying to change it.
So we're learning that the man whom we are talking about when we're discussing the sex addiction, he does not feel distressed about what he has done, even though we don't have the details of what he has done in this video. So this tells us that this person does not suffer from sex addiction as defined by the DSM, since the DSM requires that the person feels distress about what they have done. So this person is suffering from some other disorder that the clinician would have to figure out by going into a deeper examination and talking more with the patient. Unfortunately, in this video, we didn't talk with this man at all. We didn't hear him speak whatsoever. He might have had things to say and things to add, but that is not for us to judge because we didn't hear anything. But in a realistic therapeutical context, you will have the therapist still talking a lot with this client and still trying to figure out, okay, so you don't have a sex addiction according to the DSM because you don't feel distress. And the clinician in his own mind would have to think about the different new hypotheses that he would have to come up with in terms of, well, what does this person actually suffer from if it's not sex addiction? And from this hypothesis, he would have to test them further until he comes to a conclusion on what does this person suffer from and how to treat them. So if you would like to learn more about psychology, disorders, sex addiction, the DSM, etc. from Reactions, please like the video, subscribe to the channel, and I'll see you next time. Bye bye.